Was that change for you when you went low carb, or was that change for you once you moved on to carnivore and you completely got rid of the carbohydrate?
Yeah, I would say it improved on low carb, but carnivore really is what set me free from that sort of dependence on food. And it's so interesting because it's not really something that you necessarily recognize or think about. It's only sort of in retrospect when I look back now and really realize how much energy and time I spent thinking about food. And now I just don't need to do that. Now I just go through my day, and when it's convenient and I have time to eat and there's good food available, okay, I'm going to eat. A lot of times there isn't good food available, and the hospital is a perfect example of this. And so I just don't eat, and I can wait because I know that I don't need to be eating on a constant basis, and my body is now tuned to be able to function pretty well without food if it just doesn't happen to be available. And when we think back to our ancestral roots, that's really in line with how we lived because there were certainly times when food wasn't available, and we had to be able to deal with that and survive and thrive during those periods, because that usually meant we had to go now do the hard work of finding food. It wasn't as easy as just going to the supermarket or going to the cafeteria. We had to go out and harvest the food or hunt the food or whatever it is. And so that makes sense that that's how our bodies would have evolved to work. And that's largely the situation that I find myself in these days. And I think that's a very empowering situation to not be constantly dependent on food.
Yeah, it is very empowering. You mentioned hospital food. So I've been an inpatient, and I've also seen pictures more recently of other inpatients' meals that they get in hospitals. And they don't look like what I would say a metabolically healthy style of meals. Do the people running the hospitals realize that, do you think? Or and is this just a totally profit driven thing, or a volume driven thing?
Yeah, I think ultimately it's the systemic issues related to our food supply, and hospitals are certainly not exempt from that. For the most part, hospitals are going to be following the dietary guidelines, and they don't question it because uh, they don't really have reason to question it. Again, when you look at the perspective of the healthcare system, the system works all right because there are plenty of sick people to take care of, and that continues to fuel the healthcare system. And I really, it's not that I think that the healthcare system, the administrators are thinking about it's more profitable that way, or I think very few of them would even consider the thought that, yeah, if I changed the food in my cafeteria and I made people healthier, there would be less business in the hospital. Like, that concept doesn't even come up to them, I can tell you, for the most part. And they're just, this is what the system says people should be eating. And we're not serving them fast food, so we're doing a little bit better, is the way that they look at it.
What would you say is probably the worst nutritional advice that a doctor could give their patient when the patient's sick, whether it's with something related to cardiovascular disease or not?
Yep.
What's kind of the most commonly given bad piece of advice?
Yeah, I would have to point to, eating low fat diets. I think that is the absolute worst advice that we can be given. And I think it's bad on a number of levels. The first reason that I think it is such bad advice is because it essentially forces people to eat processed foods. When we look at nature is not a low fat environment. Fat is essential to life. on many, for many different reasons. And so our whole environment and our bodies have evolved to eat fat. And this whole concept of that we need to eat low fat has been problematic on so many levels. And it is the one singular, kind of piece of advice that I would point to that has worsened our health measurably. Since we've been giving that advice, here in the US, basically since 1980, obesity, diabetes, all of these things have skyrocketed. And, somewhat ironically, I would say the one disease that was designed to manage and improve, heart disease, has not gotten any better since we've been following that advice. So that is really, I think, the worst piece of advice that people get. And unfortunately, it continues today, despite the fact that the evidence is so overwhelming that it is lousy advice.
Speaking of advice, we hear all the time that you need to lower your LDL. You've got to
Yep.
get your LDL down. Just keep your LDL low. Um, First thing is mine's sky high. So as far as the general advice, I'm probably about to pass away any moment. So is this bad advice, or is it just that it's more nuanced and we're not being given the context?
Yeah, so I think that's exactly it. What I talk to people about these days is it's not the amount of your cholesterol, it's the quality of your cholesterol, and it's the environment that cholesterol is existing in.